his meeting that treatment community. So we were focused today on the federal aspect of this. It's not in competition or conflict or in any other way with what the governor's doing. And I think he realizes what a serious problem this is, and I foresee a path ahead where we will be working.
I guess a follow-up question to that would be, a lot of people are saying that tomorrow is going to be heavily focused on law enforcement. Here we had kind of both sides of law enforcement and healthcare providers. Why was it so important to include those healthcare providers in today's summit?
Well, because as what I said at the beginning, this is a major national problem. It's a major Maine problem, and it's only going to be solved by a comprehensive solution involving everything from education to law enforcement to treatment to follow-up treatment to hospitalization. All those pieces have to work together to solve this problem. This is a crisis, and no one aspect is going to be able to solve it.
And as you heard today, many of the issues that people are dealing with, whether it's law enforcement or in the funding of substance abuse or even the regulations around Medicare and Medicaid, these are federal regulations, so you can't fix these all in one place. And I would also say I'm sure there will be wonderful things that come out of tomorrow's summit with the governor. I'm thrilled that he's having it. And as you heard today, many of the law enforcement people are the first ones to say, we got to have better treatment options. We have to have better access to some of the medications that we need. So I didn't get the sense today that people were on one side of this or the other. I think great things will come out of tomorrow's summit as well. You mentioned that only 11% of people seek treatment.
So, one of the main reasons why we know people have little access to care is really people not having insurance status. So the Affordable Care Act, I think, does really remarkable things in ensuring that substance use disorder treatment is one of the 10 essential benefits that need to be required as part of the Affordable Care Act. I think we heard today really looking at how to use the Affordable Care Act in ways to link primary care, coming up with innovative models to make sure that we are focusing on increasing access to care. The other issue that we heard about why people don't seek care is some of the stigma and shame that's still associated with this disorder. And I think we've really heard compelling and moving testimony from parents and other people how we continue to focus to really diminish the stigma. We know that stigma delays people from seeking care and prevents people. So we really need a response that increases people's access to insurance and insurance benefits with this, but also really diminish the stigma that often keeps people from seeking care.
Senator King and his colleagues have asked to lift the cap of the number of patients that Suboxone providers can treat. Do you support that, or do you recommend it?
So we support, and I think we're in agreement that we want to really look at how we increase access, not just to buprenorphine treatment, but all medication-assisted treatment. I think what we have to do is do it in a way that ensures quality care, that ensures that we're not diverting it and that we're using it appropriately. But I think the other piece, too, beyond just lifting the cap is we know places here in Maine and around the country don't have access to a physician, don't have access to a community health center that offers medication-assisted treatment. So we really have to look at this holistically. I'm really happy to say that Health and Human Services announced a number of weeks ago $100 million to support increased access to medication-assisted treatment within community health centers across the country, because we know people need access. We talked about people not having to travel 2 hours a day to get care. So how do we increase the capacity of our particularly our primary care system to do good substance use addiction treatment?
I guess now the conversation, has begun or continued. What happens next after the summit? What are we going to see now?
Well, I think one of the nice things I saw, and you're seeing it right now, is getting these people all in one room talking to each other. I think that's number one. Number two, getting specific suggestions that we can take back where federal regulations or even federal law can be changed in order to facilitate treatment and breaking the back of this epidemic. So I think you're going to see that, and then it really is, I think, a very important part of this is leadership on the local level. We heard a story right at the end about a lady in a small town in Washington County just reaching out and saying, we're not going to take this anymore, we're going to get together and do something about it. And I think those are the kinds of sort of germinating ideas that I think can really make a difference throughout our Maine communities. Maine is a big, small town, and we care about each other. And I hope that what happened here today will help us to move one step closer, because these are our kids, these are our neighbors and friends. And if this were a typical disease, tuberculosis, if there was a breakout and 200 people were dying, we'd be turning ourselves upside down to find solutions. And that's why I think this is so important to focus some attention on what is really an exploding problem. It's exponential over the last 4 or 5 years. And if we don't get out ahead of this, it's going to just have tragic results for our state across the board. Thank you all.